look at yourself, what is it that is bothering you, or what is it that brings you in today?
I've been in before. We had kind of talked previously about maybe adding just a little bit more fullness. We've kind of done it in a little bit of layers and stages, and obviously I don't want anything that's super, super crazy, but I think I'm a great candidate for filler just because naturally I have such a small upper lip, and the work that you've done previously has kind of balanced the overall features of my face. So I think we just really would even like the results more with just a little bit more, like we kind of talked about. And then I think just naturally I've always had that darker under eye and just kind of tired look. So maybe just brightening that up, especially moving into summer and wanting to wear less makeup and that kind of thing, just giving me a more bright eye, fresh look.
Looking at your pictures, what I see is, I agree, I see a little bit of that darkness under your eyes. And what causes that is the mid-face. So as we age, our skull is shrinking. And so because our skull is shrinking, what happens is our zygomatic bone is shrinking back and inwards, and then the fat pads on our face actually start to move downwards a little bit. So we get a little bit of this mid-cheek flattening as we get older. And so you can actually see that in this picture here, how we're starting to get a little bit of that flattening. So a big part of what will help with your under eyes is actually restoring a little bit of that volume back into the mid-cheek. Because what will happen is if we just fill right under the eyes and don't put anything in the cheek, then it can actually start to look unnatural or a little bit too puffy under the eye. Yeah, so for you, I do think just doing a little bit in the mid-cheek to help give you back that little apple to your cheek. And then we'll do a little bit out here to help lift as well. And that'll even help lift the nasolabial fold area, which you're young, you're barely starting to have one, but it'll help lift that up just the slightest bit. And then we talked about your lips. So you have had your lips done in the past. I think we've done them 3 times total since 2018. So about once a year. So we're just doing a little maintenance. You still have a really pretty Cupid's bow, really great hydration, but it's just time to help kind of top them off and help keep them hydrated and plump. Pretty simple. You're pretty perfect to begin with. So we're just going to do a little under the eyes, cheeks, and a little maintenance on the lips.
I'll take it all. Bring it on.
All right, sounds good.